Hello friends, this is Sonu and today we'll continue our discussion about the hypnotic and sedative drug. In the last session we discussed about the barbiturate. So today we'll discuss about the benzodiazepines. As I said in the last discussion that barbiturate we don't use due to lot of effect that it's suppress CNS too much and so on. About the difference we will discuss after the benzodiazepine discussion. So today we'll discuss about the benzodiazepine. The classification you can see that this is for the hypnotic, the drug of the choice for the hypnotic. This is for the anti-anxiety or anxiolytic, and this is for the anti-convulsion. Some of the drugs are common for them, like for example diazepam. Diazepam are common, like we can use as a hypnotic, as a anti-anxiety, and as an anti-convulsant also. And some of the other drug that for the best or used for the hypnotic, some of drug for the anti-anxiety, and some of the drug for the anti-convulsion. About the time duration, like L, it's a long acting time for the 1 to 3 days. Like if the person will take diazepam, so the duration or action can be 1 to 3 days. For the intermediate acting, it can be 10 to 20 hours, like the nitrazepam, furazepam, alprazolam. And for the short acting, it can be 3 to 8 hours. So this is the main classification of the benzodiazepine group. For the indication, like the most indication you can understand from there, like the it's for the hypnotic, it's for the anti-anxiety, or that for the anti-convulsion. So now let's discuss about the pharmacokinetic. That is the very important. Pharmacokinetic, it's similar like the uh, barbiturate, but little bit different. It's also lipophilic drug. Lipophilic. So due to lipophilic, it can be easily oral absorbed and can be distributed all over the body and also in the CNS. So well oral absorption and can be penetrate CNS is depend upon the lipophilicity. Next, as I said that all drug is metabolized in a liver and finally excreted with the urine. The same thing, this drug also is metabolized in the liver. So metabolized by liver, and the enzyme that to help to metabolize that enzyme is the cytochrome 3A4 and cytochrome 2C19. This is the enzyme. So by help of this enzyme, this drug is metabolized. Some of the drug is metabolized by the cytochrome 3A4 and some of the drug is metabolized 2C19. But some of the drug, like the for example the long acting and mostly long acting, and some of the drug intermediate acting, actually this drug during the metabolization are shown active metabolites. Means active metabolites means during the metabolize it's like the so like the cumulative effect, or we can say accumulation. That's why action become high. That's why action is to increase, or the action is prolonged due to the active metabolite. So we can see that the long acting drug, mostly diazepam and flurazepam, and some of the intermediate drug, long acting drug during metabolization are shown active metabolite. Active metabolite, like a cumulative effect. Active metabolite, we can say it's like the cumulative effect or drug accumulate. That's why the action become long. And some of the drug are not even metabolized by this enzyme, or we can say the exception drug. So we should mark different color. The exception drug That is the oxazepam, and that is the lorazepam. Even lorazepam are intermediate acting, but this two and one drug also nitrazepam, which is not mentioned in classification. Nitrazepam. These three drugs are not take part in a enzyme metabolism. This drug is very quickly in a liver, like it's a conjugate and the finally excrete with the urine, like in a gluconide conjugation and then excrete with the urine. So it is not take part in the enterohepatic metabolism and then with by the enzyme it's metabolized and then excrete. Not like that. That's why this drug, any patient who's suffering from any hepatic pathology, on the time you can use this drug if the person is need on the time as a hypnotic, as a sedative drug, but they're suffering from liver pathology. So on the time this drug will be the help, because this drug will not metabolize by this enzyme, and this will not more deeply metabolized by the liver. It's just by the gluconide conjugate and it's become excreted by the urine. That's why this is exception drug which is not take part in the metabolism in the liver. So this is exception thing that you should remember. And some of the drug which interact of the enzyme, that is the drug interaction. This drug is which is inhibit the cytochrome 3A4. Inhibit. This drug is the ketoconazole. This is the antifungal drug. Then cimetidine. This is the H2 blocker. And isoniazid. This is a very popular drug for the first line drug of the tuberculosis. And erythromycin. This is the macrolide antibiotic. And some other oral contraceptive drug. So actually this drug is inhibit the cytochrome 314. And as we know that cytochrome 314 are metabolized some of the benzodiazepine drug. Not all drug, but some of the drug is metabolized by this enzyme. Means if the person will take along with the benzodiazepine and as well as this drug, so this drug will inhibit the cytochrome 3A4, and as we know that by help of this enzyme, this drug will be metabolized. Means the action of the metabolite becomes low, or it will be inhibit the metabolization of the benzodiazepine, and drug become accumulate, or cumulative effect can be there. So it can be toxic effect can be seen if apply the both drug in the same time. That's why on the same time we should avoid the both drug. Either we should use this drug, either we should use the benzodiazepine drug. Otherwise the toxic effect you will be see. So this information very important. And like a barbiturate, it also penetrate the placental barrier. That's why it's also absolutely contraindication for the pregnant lady, and as well as those lady who breastfeeding of the baby. Those ladies should also avoid the benzodiazepine group, and as well as barbiturate that we discussed. And one thing also I have to mention, that after the penetration of the CNS, from the CNS it's accumulate in a skeletal tissue and the adipose tissue. So this thing also you should know. So this is, I think, about the pharmacokinetic. And the metabolism of the benzodiazepine are two phases. First phase is the liver microsomal, and the second phase is a gluconide conjugate, and finally excreted with the urine. So like for example, the long-acting drug is mostly metabolized by the liver microsomal enzyme. So like the diazepam, most probably diazepam are phase 1, that is a phase 1 and phase 2. So phase 1 and phase 2. By 2 phase, the diazepam drug is metabolized. First phase, this is the liver microsomal enzyme. Liver microsomal enzyme. And the second one, this is the gluconyl conjugation. And then finally filled with the urine. So diazepam will mostly metabolize by the phase 1, that is the liver microsomal, and short acting drug and some intermediate acting drug will metabolize by the gluconyl conjugation, and then finally eventually both excrete with the urine. Now let's discuss about some pharmacological effect. By the pharmacological effect, you can see from the classification that it has hypnotic effect, anti-anxiety effect, and anti-convulsion effect. So hypnotic effect, if you will increase the dose, you can see anti-anxiety effect, anti-convulsion effect, in anti-convulsion means muscles become relaxed. That's why we can use also this drug as a tetanus in epilepsy. And hypnotic means it's increase the sleep conditions, and in sleep cycle actually it's increase the second stage of the sleep cycle and decrease the rapid eye movement. As I said that we have 5 stages. The normal sleep cycle according to the physiological limit. Sleep cycle, like in a zero phase, in a zero stage, the person becomes just a lying position and they close the eye and they're thinking about what they have to do and the whole thing. But it's an awake condition. In a first stage, means person is just try to sleep. Means if the little bit noise will be there, the person become awake. And the second stage, in this stage we can say the person almost in a sleep condition. So this drug benzodiazepine are increase the this stage, means the person in a sleep condition and increasing this condition. That's why the duration of the sleep become increased. And the decrease the REM, that is the after rapid eye movement, means after the 90 minute or 80 minute, this stage become created during the normal sleep cycle. So this is, as we know, that is a dream condition. So on the time, if the person is become too depressed or become too like any other problem due to depression, so on the time this drug become decrease the REM cycle. Otherwise they will in a dream condition and they become awake and they become more excited, or some other conditions can be appear. That's why this drug is decrease the rapid eye movement and increase the second stage, that is the main sleep stage. So as a hypnotic effect, anti-anxiety effect, the muscles become relaxed, anti-convulsant, they increase the second stage and decrease the rapid eye movement. This is the, we can say, main pharmacological effect. About the heart and the respiratory, even in a high dose, not seen any effect, not any significant change. But in some patient, even like more than high dose, can be decreased BP, but very rarely, and decrease the respiratory rate because of the medullary suppression. But very rarely, if the more than high amount if you use on the time, you can see this effect. So I think this is the main pharmacological effect. About the indication you can also, from the classification you can also understand, because it's easy to memorize, that if you memorize these types of classification, the indication you can very easy to learn that in a hypnotic drug we can like if the need the as a hypnotic, you can use this drug. If you need the as anti-anxiety or anxiolytic, you can use this drug, and as an anticonvulsant you can use this drug. So as a hypnotic, anxiolytic, and anticonvulsant, then panic disorder, and sometimes seizure attack. That is also, it's belong to the anticonvulsant, seizure attack. Or in some patient that alcohol abuser, in alcohol abuser, in some conditions can be used, like the for the prevent the alcohol drinking. So this is the main, we can say the main indication that we can use the like a benzodiazepine as a hypnotic, anxiolytic, anticonvulsant. In anticonvulsant, like in epilepsy or tetanus, during the in a panic disorder, in seizure attack, or in alcohol abuser, and also in a general anesthesia, but combination with some other drug, not like this drug. So this is the main indication we can say. What could be the side effect? Side effects. Side effects mostly like the loss of memory, mostly short-term memory, but in a high dose. Drowsiness, then unpleasant mood, vertigo. In some cases, dry mouth and blurred vision. Are seen, but mostly whenever use the flurazepam, in this, like some patient are complain about when they take the flurazepam, dry mouth and blurred vision and irritation are seen. But most tolerable drug are of the benzodiazepine. If in a normal dose, no any side effect can be seen, but if you increase the more than normal, this type effect you can see. But mostly it's a good drug and very tolerable drug. So about the side effects, it is the mostly you can see seen in the patients, most probably this of side effect. But if you increase the higher than more than the much higher doses, so maybe some other effect can be seen. But most even in sometimes BP also can be low and respiration can be also low if they will suppress the medullary area. But it's too much doses, more than higher doses. But in a normal dose, and if the little bit, if you increase the dose, this types of side effect you can be seen a person take the benzodiazepine. About the contraindication, contraindication. First of all, as I said, that pregnant lady. Absolutely contraindication. This drug as well as the benzodiazepine group. Barbiturate drug and some other drug also the contraindication. Then hepatic insufficiency, hepatic insufficiency, kidney pathology, then hypersensitivity, but hepatic insufficiency, in this time person can be take oxazepam, lorazepam and nitrazepam, as I said. On those time that person is suffering from hepatic pathology, but due to some other CNS disorder, they have to take benzodiazepine drug also. So on the time this drug of choice uh, you can be give the person, but not all, because all drugs are mostly metabolized by the liver and the person suffering from the hepatic insufficiency, so they can be toxic. That's why on the time you have to very careful. So I think this is the main contraindication. About the mechanism of action, we already discussed in the first videos, but very briefly we will discuss again. Mechanism of action. First of all, as I said, that mostly it's a facilitate or it's increased in somehow the GABA receptor. I mean the GABA neurotransmitter. That is our inhibitory neurotransmitter. So it's a facilitate the GABA. Means the benzodiazepine, it's increase the time of the chlorine ion influx or increase the time of the chlorine open channel. Then it's act on the mostly all over the brain, but mostly in limbic system that control our cognitive function and memory function, short term memory, long term memory. Then reticular formation, that is a maintain our sleepiness. And in a cerebellum also it's act on a cerebellum little bit. That's why ataxia can be developed, like you can't move it if the benzodiazepine group of the drug, if you take the more than normal amount, so during the walking, during our balance, you can't maintain our main balance because of the little field effect on the cerebellum in high doses. And as I said that the GABA A receptor have 5 subgroup pentameric, 2 beta, 2 alpha and 1 gamma. So it act on mostly gamma and alpha. It's act on the gamma and alpha. Let's see. For example, this is our cell membrane, neuronal cell membrane, and this is the chlorine ion channel. So benzodiazepine group, for example, this is the 5 pentameric subgroup. Some of the group for the GABA neurotransmitter, some of the area for the benzodiazepine. So benzodiazepine are bind there. And it's open the chlorine channel, like it's a close, whenever it's a bind, it's open the chlorine channel and chlorine go inside. And as we know that whenever chlorine will influx inside the neuron become hyperpolarized, means it can't be stimulated, it can't be generate the depolarization, and excitation become decrease, and CNS become depressed. So this is the main mechanism, like you can understand that how the benzodiazepine group increase the calcium channel. Also, if they increase the amount of the benzodiazepine, it can direct mimic the GABA receptor, but mostly in this case, barbiturate are the most famous for the mimetic of the GABA. But in these conditions, mostly it's bind and increase the chlorine channel. One thing also, alcohol, like those person who taking alcohol along with the benzodiazepine, That is the synergistic effect you can see. Missed synergistic effect. Synergetic effect means alcohol plus benzodiazepine. As we know that alcohol also act on a CNS, it's like direct open the chlorine channel. Plus benzodiazepine are also in different way, it's also open the chlorine channel. Means effect become too much high and CNS become too much depressed. So on the time you have to careful if the alcohol, the person become take too much alcohol and they take benzodiazepine, they can go in a coma also and they maybe sometime die also because the synergistic effect increase too much. The CNS become too much depressed and it can depress medullary area. Medullary paralysis can be occur and then cardiac and respiratory failure. That's why you should know. So this is the main our effects and about the main information about the benzodiazepine. And as I said that it's a very good drug, very tolerable drug. That's why nowadays as a sedative and hypnotic usage worldwide, this drug are mostly using. We don't use nowadays barbiturate. Some of the barbiturate use for not as a sedative and as a hypnotic for the some other conditions like a anti-epileptic or some like for the general anesthesia, but not as a hypnotic and as a sedative and anxiolytic. It's not drug of the choice. So this is all information about the benzodiazepine. Let's discuss some difference between barbiturate and benzodiazepine. So here benzodiazepine and here barbiturate. So first, it's less neuronal depress. In these conditions, it's very high depressed. If the little bit you increase the amount, neuron become too much depressed. So high neuron depressed. Then benzodiazepine, no pain generate. But in barbiturate, in normal amount, hyperalgesia are seen. That is the increased pain. Then, in a respiratory rate, blood pressure, no any changes. In high amount it's little bit change, but in a normal no any change. But in this condition, decrease the BP, decrease the respiratory rate, and sometime failure due to medullary paralysis. Then in these conditions, no any enzyme inducer. No any enzyme inducer. But in barbiturate, potent enzyme inducer. So less neuronal depress, no pain generate, and respiratory, blood pressure, no any changes, no any enzyme inducer. But barbiturate, it's highly neuronal depress, hyperalgesia are produced in a normal dose, pain become stimulate, the decreased BP, decreased respiratory and sometimes failure due to medullary paralysis, potent enzyme inducer. So this is the main we can say differences. That's why the benzodiazepine is good drug for as a hypnotic, as a sedative, and barbiturate we don't use due to this problem, because in some of the a person is just for the little bit depression, they have to work with taking the drug along with the drug. So if you apply the barbiturate, they will sleep, they can't work, even they can't move, they can't stand due to the this effect. But if you give the benzodiazepine group like a short acting and some intermediate acting, they can work take the drug. So that's why benzodiazepine group is the good drug, and due to this reason, most widely we use as a hypnotic and the sedative. So this is about barbiturate, that is a very important drug, important group of the drug for the hypnotic and sedative. In our next session, we will finish the hypnotic and sedative, that is the jet drug and some other miscellaneous drug. But mostly benzodiazepine drug are important. So hope you will like our benzodiazepine discussion. In the next session, we will discuss or finish the hypnotic and sedative chapter, that is the jet drug and other miscellaneous drug. Thank you so much.